call the meeting to order. Mr. Jones.
Thank you, Mr. Chairman, Commissioners. We have requests for an addition to the agenda tonight on behalf of Ms. Lee Moore, who is requesting board representation at a Scenic Walton Impact 100 grant application presentation. You have her request there, and we would also suggest that if that is something you look favorably on, that you would ask staff to draft a resolution of support for the chairman's signature so that that can be added to that presentation. Certainly no commitment other than the board is supporting their initiative. There's no financial commitment whatsoever.
Okay.
And under deletion is a request to delete item number 31, which is the Lafayette Creek Boardwalk improvements bid process. We're asking to hold that off till the next meeting. That's all we have, Mr. Chairman.
Okay.
Motion
To approve the changes.
Second.
Got a motion and a second. All in favor, say aye.
Aye.
Opposed? Motion carries. All right, at this time, it's for public comment on agenda items only. I would like to, in case you haven't been here before, maybe been some time, each agenda item will have an opportunity for public comment. So you don't, unless you got to leave, you got somewhere else you got to go, if you will hold till that time, then we can keep it in the same silo as what we're discussing. Is there any public comment concerning an agenda item? Seeing none. I see none on Zoom. So we'll move on. Is there any items to be removed from the consent agenda for further discussion? Seeing none. Entertain a motion to approve the consent agenda.
Motion to approve the consent agenda.
Second.
Motion and second. All in favor, say aye.
Aye.
Opposed? Motion carries. I believe the next item up is waste management EALs. I acknowledge my conflict of interest, will not vote on this. I've supplied the proper form to the clerk. So what's the board's wishes?
Motion to approve.
Second.
Got a motion and a second. Any public comment? Seeing none, all in favor say aye.
Aye.
Opposed? Motion carries. Okay, Ms. Jones, number 27.
Thank you, Mr. Chairman. Our first item is our COVID-19 update. Ms. Holly is here to share that information with us.
Good afternoon. I almost said good morning, but I'm glad it's the afternoon. It's been another long day, but thank you all for doing your work that you're doing for our community. We appreciate it. Holly Holt, Department of Health here in Walton County. The latest update I have, and I'm going to go back 2 weeks instead of last week when we were here for the emergency, or not emergency, but an extra board meeting that we had. So 2 weeks ago, the total test, and I'm still including Stone Lab. I know every time I come to you, I say it's going to be added to our list, but I definitely have been given some information in the next couple of weeks. We should have those tests included of all the tests that we've done, including Stone Lab. But 2 weeks ago with Stone Lab, there were 9,438 tests done. Today, 11,254 tests. 2 weeks ago, we had 1,066 positives. Today, 1,428 positives. 2 weeks ago, we were at 12% positive. Today, we're at 13% positive. COVID numbers, hospitalization numbers, we have, and this is a report from Sacred Heart, but it basically covers both of the hospitals too. But we have 11 COVID positive patients in the facility. 2 are in ICU. 1 is on the vent. And then there's a total of just 12 patients in ICU there.
Holly, could you repeat the number of ICU patients?
Two in ICU, that are COVID patients. COVID patients, excuse me. One of those is on the vent. There's a total of 12 individuals in the ICU. 2 of those are COVID positive.
So those additional 10 is from other things?
Other things. Still the same age range, 0 to 101 years of age. So far, we've tested, and there's been a positive 680 males, 625 females, so it seems to be targeting more males than females. So that has not changed. When we first started, it was more females than males. But in the last couple of months, it changed with those statistics. We have had, and as today, there was a question about the amount of deaths because sometimes we get the information before what is reported on the dashboard. So as of today, we have had 16 deaths. 2 weeks ago, we had 12 deaths by the end of that day. I guess the additional deaths have been 2 more from some long-term care facilities, and then the other ones are community spread, acquired deaths. For Florida, the total positive cases as of today, 542,792. Total state deaths, 8,553. That's the information I have today, unless anybody has questions.
Okay. Holly went on the Department of Health dashboard,
Right.
and I pulled up Walton County, and I pulled up the state in the metrics part of it, and it's showing a decline. Do you agree with that?
There is a decline for the positives. Our state surgeon general spoke yesterday and told us, I believe it's 8% statewide.
Right.
And for us, we're hovering around that 12, 13%. But I have seen a few go down in the last few days, and we are continuing to test as much as we have been.
Okay. All right. Any other questions?
I
from Holly?
do. Holly, I just want to make sure that, I'm seeing some emails and people are concerned that the flu is being tracked separately. Is that correct?
That's
So
correct.
none of these numbers include the flu?
No, ma'am.
And do you have any stats on the flu?
Yes, I went ahead, Commissioner Nipper had mentioned a few things about flu, so I wanted to give you a little bit of information about that. Went ahead and researched, I don't know if you know this or not, but the flu is not a reportable disease. So it's very hard sometimes to get information, except for the state of Florida. There's a couple ways to obtain that information. One is through the emergency department. When they come through, those are reported. Also, you're getting it through the lab. So when the lab tests and it's positive. So let me just give you some updated information about influenza. And so when we pulled the data, we pulled from August of last year until now. So basically, it's August 1 of 2019 to August the 8th of 2020. So far, for this last year, we have had 353 positive influenza tests, 1,869 negative influenza tests, which gives us a positivity rate, and this is for Walton County specifically, 15.89% positive. And then there's a breakdown between all the different types of flu types, which I don't feel like that's probably what you need today. So that's the information that I do have.
Right, and
Go let Commissioner Nipper finish up. Go ahead.
is SARS, and there's another, is that also a flu? And then is that trackable? Are they keeping numbers on SARS and
Well,
other ones? And we're tracking COVID so precisely, and yet you're saying the flu isn't trackable.
the flu is only trackable through the emergency department
Right.
and the lab, but it's not a reportable disease. We have a reportable disease list that we go by. COVID, of course, is on there. It's a reportable disease. The SARS-CoV, which is part of COVID, that's reportable, and I believe MERS is on there too. But there's a lot of reportable diseases that we do keep up with, HIV, TB, some of those things.
Thank you.
You're welcome.
Is death rates reported with flu in your report?
Okay, so good question. Only the pediatric death rates.
Only pediatric?
Only pediatric death rates are reported. And there's various reasons for that. I think we talked about this one time with COVID. You know, it could be one of the diagnoses. So where the flu is concerned, it could be one of the diagnoses. Sometimes they don't know that the person tested positive for the flu until after they passed away. So there's various reasons for that, that I know on the Department of Health website, it tells exactly why those things are not reported for an adult, but they are for pediatrics. We've had 0 pediatric deaths in this last reportable year that I just talked about.
Do you have any numbers? Are you through, Mr. Nick?
Yeah, go ahead.
Do you have any numbers for flu for last year?
Well, the report I just mentioned was from
Do you have any-
August to August.
Do you have any for the year before then?
No, not on me today, but I can
Okay.
get that for you.
All right, I'd like to see those numbers. It still bothers me that we have all the numbers of test positive, and we have no numbers on people that have tested positive, but they don't test positive today. So it makes us look like that we've got, what was it?
1,400.
Yes.
What's our number right now for,
Our number right now is 1,428.
right, okay, that's what I had written down, but I wanted to make sure. So it looks like that we have 1,428 cases of COVID. We have nobody with, not even one person in the statistics that says they've had COVID and they no longer have COVID. To me, that makes this whole thing very misleading. I am concerned that, listen, I'm wearing a mask. I think it's a serious situation. I'm not telling everybody else to wear a mask. That's their business. But what I'm concerned about is this has turned more into a political issue than a health issue. And I think that we need to
Please.
get somehow, and I know we've sent, a letter, a resolution to the governor asking for help on some of these problems we're having with figuring out. It's just insane to me that we don't have a number of people that don't have the virus anymore. We've got 1,428 cases that have tested positive and 0 that have said they don't have it anymore. And I'm not blaming you. I know that's not your fault because you and I have discussed this till we're blue in the face. But I also question, a friend of mine told me, so this is not scientific evidence,
Okay.
but he told me that his friend went to a COVID test, filled out the paperwork. The line was too long. He got frustrated and left. Several days later, he got a letter that said he tested positive for a COVID test he never took. And that's troubling to me. I just,
And I can,
I would like, and I know, Holly, you're doing a great job.
thank you.
And I'm not anything to do with the health department, but somebody has got to have a number to say, we had 1,428, but now we only have 99 that are actually tested positive right this minute. I mean, if it's true, within 14 days, basically, I know the numbers fluctuate, but you're either cured or dead. And this has been going on since February. And we have 0 cases that are cured as far as the statistics go. And I'm getting a little passionate. I don't mean
That's
that to
okay.
be at you.
I get passionate too.
It just drives me crazy that when you look at the numbers statewide, we've got people that have tested positive in the,
The mix,
and they're well now.
right.
Got them in the room.
Yeah, I know that. I just looked at one of them. But the thing is, you got people that are positive, but there's no number for that. And I don't think anybody's concerned about that but Tony Anderson. It bothers me that we spout out these numbers, and that's all the numbers we have. So again, you're doing your job. But we have these numbers, and everybody's going, oh my God, we got 1428 that tested positive. But what if that number is really only 28 that are sick right now, or 48, or 148, instead of 1,428? It's frightening to walk around when there's 1,428 people in Walton County that has this disease.
Well,
But there's really not 1,428. You know what I'm saying?
Oh, sure, and I think that's what we have to look at. Yes, that is a number, 1,428, but we all know there's not 1,428 people that still have COVID. Now, it's an evolving process, and we know with COVID, we learn something every day. Do we know the real true percent of how many are recovered? No, we do not.
Well, I know there's one that's recovered. And that
So,
person, I'm not gonna say is male or female, but they're in this room.
right, so,
Ms. Holly, before you answer that.
okay,
That's one thing we've asked
The governor.
the governor and others to try to give us what is recovery.
right,
And nobody seems to know or is willing to give any definition. But you go on the dashboard and you look at the United States, there's that one tab over there for that. They show a recovery rate.
recovery rate.
But you go into Florida, you don't know nothing as far as that's concerned. And I don't know, it probably never gonna get anything out of Tallahassee to give us that definition, but agree, you got 1,400 and some people, they tested positive. But we only had, can't find my thing now, but we only had 60 something at one time, it was in the hospital. And they're not there now.
And it affects everybody in a different way, which we all know that. You know, it's horrible that it affects some people with a death rate. I mean, we've had people, I don't know if y'all are aware of this, we had one of our employees pass away 2 weeks ago at the health department. So it has hit us tremendously there. And I can honestly say through contract tracing, that did not come through an internal situation. It was an external situation. So we are very passionate about this. Every time I get in my work car, I think of that individual. So, we all totally understand, and I understand what you need and what you want. What you all did as a board to send that resolution up was perfect, because it should go all the way up to the top. I continue to communicate to who I can communicate with about what the needs are for Walton County, and I have communicated that several times over several conference calls. So for that to come back, it does go up, and then it can eventually come back down. But I think we need to also look at the last 2 weeks, how many we actually have had positive, the amount of tests that we've tested, because you still have people here that aren't testing that are positive. They're asymptomatic. They don't have a clue that they've got COVID. So that we know is still this going on in this community. And with schools opening up next week, we're going to see more, because we've got kids together and things like that. That's just normal. It's just like any type of gathering, you're going to see more as we move forward. But the asymptomatic thing is really huge, because we don't really know who has it unless they're tested.
Well, most of you here know my feelings of lawyers. Our lawyers are excluded from that. But I can't wait I could see this happening in the future in a murder trial. And the lawyer says, Your Honor, my client didn't kill him. He had COVID. He died of COVID. So, I mean, if we're counting somebody that was killed in a car wreck as a COVID patient because they tested positive after they were dead for having COVID, they were asymptomatic, but they count as a COVID death and a bus ran over them. What's to say, hey, that guy was murdered, but he died of COVID, so we have to let this guy off. I know that's way out there on the rim, but that's the crazy thing about these numbers, that is just frustrating all of us that have to make decisions for Walton County, are just, and you fought for us, Holly, and I appreciate that, to get these numbers, but to get the numbers of how many don't have it. but it's just frustrating as all get out that there's no cure rate. Okay, we're at 13%. I wonder out of that 13%, how many of them don't have COVID right now? You know, what if we only have 0.5% that have active COVID right now? It's just, I mean, it's very frustrating.
All right. Any other questions for Holly?
What's the average recovery rate for COVID? What's on the average?
14 days is when you're allowed to go back. Basically, there's some more guidelines from the CDC, but 14 days is what the general rule is for recovery.
Give us a recovery rate for just say the next 30 days when you come back. What do we test last 30 days?
I could tell, we could go through,
Just
I mean, these
round
numbers have
numbers.
gotten huge. I'm just gonna tell you, we started, you know, with a few, and now we're up to 1,428 positives, and we can go back through and look to see out of those, how many are past 14 days. But I will tell you this, there are people that are still testing positive for COVID. Okay, so you've got that definition. So you've got various definitions. You've got somebody that has tested positive for COVID, and they go back 2 weeks later and retested, they're negative. And you've got other people that are still testing positive, even though what we have learned is after the 14 days, or the viral load is probably, because we're still learning all this, down to where they're not contagious. They're not communicable because their viral load is lowering, but they're still testing positive for COVID. That has happened with some of the individuals that we have been dealing with.
Okay.
So it's very hard to.
I asked you a question about that,
Yes.
and I don't mean to interrupt
You
you.
did.
I know, I'm sorry, Mr. Chairman. I'm just, I get really passionate about this, and Holly, again, I know how hard you're doing, how hard you're working, how hard you're trying to get the numbers we're asking about. But if I have COVID, if I test positive, and I go in quarantine for 14 days, I'm perfectly fine. I don't have any symptoms or anything. I come out, and I test positive again. Does that count as another positive case?
No, you're
Okay.
one case.
Okay.
If you test one time, you're a case. You could test 20,000 times, but the first time you're a case, that goes into our numbers.
Okay.
After that, no.
Mr. Chairman,
Yeah.
one quick one. The bottom line is, 2 weeks ago, we were running 30 or 35, 40 positives a day. It looks like the last week we've been under 20.
Yes, sir.
Day was like 14.
Sure. Mhm.
So I deduce from that things are getting better. Is
It
that
looks
fair?
like a downward trend, or we're kind of stabilizing right this minute.
Thank you, ma'am.
Mr. Chairman, one more quick one. What age for children should be wearing masks or should not be wearing masks?
Well, I think the
From
CDC says they're looking at 6 and over. And then I know if a child has some respiratory issues, those are things you need to be careful. They're a vulnerable population because of other risk factors, but around 6 and up.
All right, thank you.
Chairman,
Go ahead.
I'm sorry, I just, all right, you said, and I may have heard this wrong, so you said if somebody has, if a child has, say, lung problems, should they wear a mask more or wear a mask less?
Just think about a child that has asthma. They may have difficulty breathing. It's just like an adult or anybody else. You put a mask on them, it causes maybe some shortness of breath. Those are the ones you want to watch out for and not wear a mask if
Okay.
possible, unless, you know, it's been approved by their physician, or, you know, their parents are good with it, or, you know, whatever. But need to be careful with that with a child.
So I'm sitting up here wearing a mask. And I wear masks out. I don't wear them when I'm outside, but I do if I go into a building. I'm around a lot of people. I don't want somebody to come back and say, hey, you're the one that gave me COVID. But that's my choice. I'm not saying everybody else has to want marijuana. That's my personal choice. But again, in my brain, I have a question of, am I breathing in carbon dioxide by not having it go out into air? And I've heard the CDC say we need masks. I've heard them say we don't need masks. Then again, we do need masks. But I'll be honest with you, I don't like doing this. I'm sweating and I'm not breathing really good. And if I'm not getting all my carbon dioxide out, I'm killing trees beside that.
Right.
So,
Okay.
I mean, is it really necessary to wear a mask?
Well, we encourage everybody. This is the thing. When you wear a mask, you wear a mask if you cannot stay socially distanced. That is the key to it. If you can stay socially distanced, then you might think twice about it. But for some people, they're going to wear a mask because, they don't know if they're staying 6 feet. And me too. I'm going to wear my mask because I don't know that I'm actually staying 6 feet socially distanced with somebody. And remember what a contact is. It is 6 feet or greater, 6 feet or less, 15 minutes or greater. That's considered a contact to you. So if you're just breezing through somewhere, going in, coming out, and you're not going to be around a lot of people, those are things to think about. But socially distance is the key. A mask is very highly encouraged because a lot of people don't know that they're not staying that 6 feet. So that would be what I would say to you.
What about my carbon dioxide question?
I can't really answer that question.
Okay, well, so, being that I know not many people can stand to be around me closest than 6 feet for more than 15 minutes, I'm okay then.
Right. And I would tell you this, if you're feeling funny because of the mask, you need to talk to your doctor about it. That's what I would tell you to do.
Well, I just, I have had that thought about carbon dioxide, because sometimes I feel like the air's not getting out.
Okay,
That may just be in my
all right.
mind.
Let's bring this thing in for a landing.
Okay.
All right. Anything else, Holly? All right. All right. I ain't gonna ask you if you got anything else to say. But anyway, all right. Well, that takes care of that update. Unless, Mr. Jones, you got something?
Just a reminder that may help some in the public that are listening. At our last meeting, we presented to you and you kindly approved the ability to use some CARES Act funding for nonprofits. Just want to let those folks know, and if you're listening or here and you know of any nonprofits that would like to follow up on that, the application information they need is on the homepage of our county webpage. So it's very easy, very accessible, but, we'll certainly entertain any questions anyone has, but we're trying to make it as easy as we can to get through that process.
Okay.
And I believe there are a couple of, I think Heather has the next item.
Well, let me hang on a minute.
Okay.
I know there's a lot of people out there that come to talk about the mask, but
Resolutions.
but I was hoping I can hold y'all until we get to the resolution, and then we'll take your public comment. Is that okay? All right.
Okay, Chairman, the next item on the agenda is the request consideration and approval of the extension of the COVID-19 local state of emergency resolution. And on this, I would ask for one change. The resolution that's in your book references August 4th through 11th. That was last week. It should be the reference to August 11th through 18th. So if you make a motion, I would ask that you include that the date August 4th be exchanged to August the 11th, and any references to August the 11th be August the 18th.
Okay.
Thank you.
Entertain a motion
So moved.
with those
changes, yes.
changes, okay?
Second.
I got a second. Any public comment? Yes, sir. Remind everybody who haven't been up here before, when you come up and introduce yourself, spell your last name so the clerk will have the record.
My name is Carl Hawkwitz, Hauquitz.
Go ahead.
And after what I just heard, I don't understand why we have an emergency. I mean, she's just telling us that we don't have any idea how many people have COVID. We have a good idea it's not what they say, And as I look back on the last 14 days, there's only been about 560 new cases. Well, it's only last 14 days. That's 560 cases. CDC says 1 in 6 ends up in the hospital. That's 93 cases. Do we have 93 cases in the hospital? Nope. Of those 6, 10% will die. That's 9 dead in 2 weeks. Do we have 9 dead? No. So what's our COVID emergency now? It's going down. We don't even know what the numbers are. How can we have an emergency? We don't even understand what we have an emergency for.
Okay, thank you. All right, anyone else? Okay, what's the board's wish? Do we have a motion and a second on the floor? All in favor, say aye.
Aye.
Opposed, motion carries. And Carl, for your benefit, the state of emergency allows the county, in the event we have a major uptick or whatever, to go ahead and continue to use our emergency powers to take care of whatever may come from that. And that includes funding if there is some available to us during this operation. So that's one of the primary reasons it's still there. And I have a tendency to agree with you as far as your numbers and your analysis. However, I don't want the county to be in a position where all of a sudden I got to scramble to find the commissioners so we can go back into emergency session. So we just continue this on down the road, and that's primarily the reason for it. Okay.
Mr. Chairman, to add to that, I believe Bay County and those counties to the east are still under a local state of emergency from Hurricane Michael that was 3 years ago. It's just government. Bear with us.
Okay, number 29 has to deal with the mask resolution. I assume everybody's had a opportunity to read it. It's been on the website. I've gotten a few emails. I want to go ahead and just put this out on the table. I've gotten a few emails from folks saying that we're mandating a mask through this resolution. We are not mandating it. Don't let that, please understand that. Everything we do in there is encouraging people to do it. It's no different than Walmart, Publix, or anybody else. They took it upon themselves to limit people coming in with a mask. They have to have a mask. Now, if they come up and say, I got a medical issue, they can't force them and they can't inquire beyond that because of the HIPAA. So this is just an encouragement to, when you can't social distance, to consider wearing a mask if you so fit. All right. Heather, you want to go over that?
Yes, Chairman, the directive at the last meeting was to have my office draw up a resolution encouraging people to wear face masks. This resolution does just that. It recognizes that there is a serious threat to public health via COVID, and the relevant provisions are that every person living, working, visiting Walton County is encouraged, when social distancing is not possible, to wear a face mask in any public location. And then the second thing that it does is it encourages businesses to post their businesses with their policy regarding whether their patrons are to wear masks or not wear masks. And that's up to the businesses. But again, those are both encouragements only and not mandates.
Okay. I know there's several out there I talked to earlier before the meeting started that wish to make a comment. I would ask if one gets up and the other one coming up wants to say the same thing, just say ditto, and that way we can keep this thing moving. All right, so.
Before we do that, can we?
Make a motion?
Well, I'll make a motion, but on the section 2B, about the middle of the first sentence, it says direct. Direct implies that there's some sort of duty.
Yeah, mandate.
So I would like to strike the word direct.
You got
I'll make a motion that we accept the resolution, but I want to strike the word direct in that section 2B, the 6th word over.
Would you like to replace it with ask or something a little bit less?
All businesses are encouraged to ask invitees. So I actually would strike direct business and say encouraged to ask invitees.
I'd like to second for discussion.
Go ahead.
I think,
Hang
go ahead.
on.
I'm sorry.
Should we add the 6-year-old for kids? I don't know how much we're going to break this down. If we need to, we got CDC guidelines, but I know Mr. LaSalle is here and I've got his email up, and I just want to make sure that we are addressing without restricting. I just want to put it out there.
I would,
Add,
I have no problem with adding that language except, I have no problem with adding that language. I would say that this entire thing is just a recommendation, encouragement. There's no, I want to make sure that everyone understands there's no direction or mandate.
All right, so
That's what you want, if you want to add that, that's fine with me.
I can provide suggested language to that. I think that would do the job and not change this very much. If you'd like, I can tell you right now. The thought I would have would be at the very end of section 2, item A, where it says to wear a face covering in any public location, to add the language and otherwise follow all CDC guidelines
I think that works for me.
Try
That's,
That works for me.
or other CDC guidelines. This is section 2, item A, the very end of the sentence, add language that says and otherwise follow other CDC guidelines.
I'll amend the motion to that.
okay, we got a motion, a second. All right. I think I'll hold off on my comment for now. All right, I'm going to open it up for public comment. So if you want to make a comment and reference this, you see the clock up here, please adhere to the time. Just to introduce yourself and spell your last name for the clerk. Okay, who wants to raise their hand? Come on. Okay, everybody, I'm going to start on the wall and go that way and then come down this row here, okay? And like I said, if the person ahead of you says the same thing you was going to say, please just acknowledge that, please.
My name's Emily Wever, W-E-V-E-R. Prior to the July 4th Board of County Commissioners meeting, Samantha Herring from Seaside requested that a mask mandate make it on the July 14th agenda. During that meeting, there was much back and forth about masks, but perhaps most importantly, and this can be found on page 8 and 9 of that meeting's minutes, Mr. Chapman thanked Seaside community for the precautions they are taking to combat COVID-19 and requiring their customers to wear masks inside the businesses. He encouraged other businesses to follow Seaside's example. However, that mask discussion didn't end there and was pushed to the July 28th meeting. I and others attended that meeting as we feared a mask mandate was a possibility in Walton County and felt for various strong reasons that was not acceptable and shared those with you then. And I left that meeting grateful. I was like, oh, I don't have to choose between breaking the law and putting my staff's health at risk. I was grateful when I left that meeting. But then on the way home, someone called in at the last second, and here we are, discussing masks yet again in the form of a resolution. Here's the issue. Mr. Chapman, you've already said everything that's in this resolution on July 14th, and it wasn't enough. So here we are again discussing this official resolution. And I don't know I don't know why this board thinks that's going to solve the problem. When this is over and you guys vote or don't vote, at the end of this meeting, come public comment time, it's going to be back up. And we're all going to be here to have another long Board of Commissioners meeting again next 2 weeks. The news channels that were here, that were present at the July 28th meeting have said nothing about this resolution. They only mentioned that y'all wouldn't pass the mandate. Public media is abuzz with complaints and frenzied hysterics that this board will not pass the mandate, even though they've all known, like me, since July 28th, that this resolution was a possibility. I appreciate your effort to appease both sides, but with no appreciation from mandatory mask team about meeting in the middle, I do not believe you will achieve the results you are hoping for, and the many emails and calls you are receiving will continue on. It's my ask that you make a motion to table the mandatory mask thing, table the resolution, table the mask ordeal altogether. Make a statement today. The CDC has made recommendations, the Surgeon General has made recommendations, and there's no need to hear it regurgitated from the Board of County Commissioners in Walton County. If you won't table it today, if you won't make a motion to table this, so we don't have to hear this ever again, then I ask that you, under Section 2, create a Section C and have it state, Local residents and businesses owners should be advised that this resolution is a recommendation, not a mandate, and is not enforceable by law or punitive fines. Please make a motion to table this.
Thank you. All right. Yes, ma'am.
Mallory Fields, Mallory, Fields. Commissioners, here we stand again defending our freedom and personal liberties against the slippery slope of mask mandates and resolutions. Although the term resolution seems accommodating, non-threatening, and appeasing, I assure you to those of us who stand before you defending our freedom, it is not. The very definition of the word resolution means to take a firm stance to do or not to do something. Note the words firm stance. Furthermore, may I remind you the definition of tyranny? Tyranny means oppressive government rule. What about the definition of the word oppressive? Difficult to cope with, causing hardship and depressed spirits? How many of us wearing masks could claim that to be true? Difficult, hard to cope with, depressing? Show of hands?
Ma'am.
I know you get the point of where I'm going, but do you see my point? When you took an oath to defend our people of Walton County, you promised to defend our freedoms. Does creating a resolution to wear a mask breach the promises and the defenses of our liberties mentioned above? Yes, it does. Therefore, you are violating the very oath you took. Let's not get carried away with accommodating the language of pro-maskers. The end game for them is not a resolution. They want a mandate, and this puts them one step closer. Our health is our responsibility, nobody else's. Those who believe that others should wear a mask for their own safety are imposing unfair responsibility, blame, guilt, and fear. I believe, commissioners, that your stance should be one where you promote each person being accountable for themselves and having the choice to handle their health as they see fit. We all know blaming is a slippery slope, one in which is never fully appeased. Lastly, if safety is a major contender for your consideration for mask resolution, then you would be wise to consider the damaging health effects of mask use. Earlier this week, a man who was standing in line in front of me with his mask pulled up, tightly covering his face in protection, of course, fainted. That's right, he fainted. In fact, I was there and helped catch his fall and protect his head from hitting the floor. Why do you think he fainted? No other reason than lack of oxygen, of course. All of us who witnessed this were asked to give an incident report, and we all agreed the mask was the culprit. This is not the only story. I am sure you have heard as many workers in our community complain of dizziness, headaches, becoming winded from not being able to breathe, and so on. Walton County is not in a state of emergency. To label it as such is false. But I would argue that the health of our community is in crisis, and it's not because of COVID. It is the hardship, the division, the harassment, the mandates, the oppressive job conditions, all in part because of mask use. These two should be your concerns, commissioners. May you stand for freedom, our choice, our liberty, and for the oath you promise us. I request a motion to table mask mandates and resolutions. Thank you for your time.
Thank you. There in the back, please. Yes, ma'am, dressed in the black. Come on forward, please.
Hi, Commissioners. My name is Hannah Fields, Fields. This is the third council meeting that I have attended to address the mask issue. As I mentioned earlier, I'm originally from New Zealand, with half of my family living in Australia. Both of these countries started by masking their citizens and are now detaining them. I am in the process of advocating outdoor exercise for the occupants of high-rise concentration camps in Australia. This is why we must defend the Constitution at all costs. By defending it, we are defending our country, our families, our future, and the American dream. This is not China or Soviet Union, so why are you allowing our civil liberties to be trampled and stolen from the citizens you have sworn to serve? Is it not enough that 95% of stores require masks, that you insist that my children and I wear them outdoors also? Is it not enough that people like myself who cannot wear a mask due to disability are constantly being discriminated against? On Thursday, my husband was harassed and verbally assaulted in a local store for not wearing a mask. He was never asked about his condition or asked to leave. He was so concerned by the behavior, he called the sheriff. The sheriff simply said, "They're allowed to kick you out." Is this an appropriate response from law enforcement who is employed to protect us? How will you rectify this in the future? And how many people have experienced the same thing? I was verbally assaulted last month at the soccer field in front of my 3 young children. According to these people, I was not socially distanced enough. I was more than 10 feet away. Social distancing and masks are tearing our community apart. Civil liberties are being violated every day. Fear, panic, physical and verbal altercations are becoming the norm. It is a terrifying experience to simply go to the grocery store. Many Walton County parents, like myself, are choosing to homeschool their children this year, not out of fear of the virus, but because we see the impact that social distancing and masks have had on our community. I don't want my kids to suffer the physical and psychological harm of having to wear a mask every day. As Walton County Commissioners, you know that no business can create a policy that violates established law, period. No executive order can violate or suspend established law. No state of local emergency can violate established law. When will we educate the businesses, the politicians, and the law enforcement? There's absolutely no scientific evidence to prove that masks prevent COVID. In fact, masks are causing severe health issues for people, such as pneumonia and lung collapse. I understand that the county hospitals and medical professionals are receiving COVID funding by calling this a local state of emergency, even though it isn't. I want you to know that I care about my family and the people in this community. I care about their health, their freedom, their futures, and living a peaceable life. Social distancing, masks, violence, harassment, assault, and law enforcement not doing their jobs is unacceptable. Commissioners, you have the legal authority, power, and duty to terminate or motion to table today.
Thank you.
Thank you.
All right, the row right here, start at the back and work our way forward. If there's anybody in that row wish to speak, and starting in the back. Okay.
J Fields, Jayfields. This is what you wear for infectious disease. I work in that type of industry, and you also need a respirator that covers your whole face. I don't have that today because we're using it at a job. So is this what we're going to require? I also have the carbon monoxide tester right here. When it gets to, I'm going to read you some OSHA stuff right now. Above 1,000, cognitive performance, decision-making, problem-solving, speed of addition is negatively affected. Above 10,000, increased respiratory rate, respiratory acidosis, and metabolic stress. I'm going to do the test so you can watch what it does. When it gets to 10,000, it goes to all zeros. So watch when I start to talk, it starts to go up because I'm talking, I'm using my breath back and forth. I can't see what it's at, but you guys can. Also, there's humidity there. It goes up to 99%. And what happens is that's a breeding ground. It's a breeding ground for, it's a breeding ground for all types of germs. So this is what exactly happens right there.
2791.
So we need to stop this. We won't comply. I won't comply. I was the one that was verbally assaulted at the Walmart. And I'm tired of this going on. We need to stop this. We need to stop this now. I have family in a quarantine camp in Australia, and it's unacceptable. What's it at now?
3555.
And it's getting harder for me to breathe as is. These masks do not work.
3603.
I don't know. When are we going to stop this?
3546. 34.
What's it at now?
3510.
We got to stop this, you guys.
36.
It's unacceptable. We're becoming a communist country.
404. 4004.
You made your point. Why don't you move on and finish out your comments?
I'm done.
Okay. Next, coming down.
Me again, Carl Hawkwitz, Hauquitz. County mask, not even a mandate, but a recommendation is a bad idea for several reasons. One, the masks are not proven. Even the N95, the vaulted N95 mask everybody loves, is not rated for biological agents. If you don't believe that, take that mask, put it on, go into an automobile paint shop when they're painting solvents, see how long you last before you pass out, right? It just doesn't do it. Even hospital surgeons, they wear masks not to protect them from their patients, but to protect the patients from them. So their breath doesn't go into the patient. The mask doesn't help the doctor at all. I know you don't have any kind of consequences now for not wearing a mask, so I don't understand why we'd have a resolution for it. There are also risks for wearing masks. You have a significant amount of CO2 that you rebreathe again, and that can cause pleurisy, which is a serious infection in lungs that you do not recover from. Japan and South Korea have determined the transmission of COVID virus requires 3 C's: confined spaces, crowded spaces, and close contact. Fleeting encounters on a sidewalk, parks, public parks, shopping aisles do not result in transmission. And that's exactly what she said. Also, the World Health Organization has defined social distancing as 3 feet, not 6 feet. Let's look at the need. Do we need something like this? Walton County's population about 75,000 people. From February until now, there's only been 15 deaths. I think you said 16 now, maybe, right? But they're only related to COVID virus. Some of them are a real stretch. They didn't die because of the virus. They died was related to COVID virus. Also, I have 1,383 cases. I'm a little behind the time, and that includes the deaths. Whatever that number, we don't have this many sick people. There's a large number of people who test positive to a flawed test. I say flawed because there's a large number of asymptomatic cases. She says they'll get sick sooner or later, but they don't. And they don't pass it on. Typhoid malaria is an extremely rare thing in diseases. 1 in millions, not 1 in hundreds. No one really knows how many cases of COVID virus are in this county, country, state, anywhere, because it's imperfect counting. The test is imperfect. Nobody really knows. I find it wrong to pass ordinances that affect all of our citizens. We don't know the extent of the problem. We have no reliable evidence or solutions even effective. Leave it to the people to take care of themselves.
Thank you. All right. Second one behind the guy in the front row. You didn't want to speak, okay, sir, in the front row. You want to speak? Come on.
Joey LaSalle, LaSalle. In recent weeks, I've had 2 clients tell me that they're coming here to flee the police state communities because Walton County feels like America. So why would we want to ever threaten that? What specific statistical data does the board have that proves that public mask wearing stops the spread of coronavirus? We can stand here all day and argue the effectiveness of masks, and the board has been presented with scientific studies that show that masks are ineffective against the coronavirus and can sicken people. You know the negative side effects, but that's not what this is about today. This is about the government overstepping into people's lives and telling them how to run their businesses, what they will require from customers just so that they can have customers. This is about the government telling people what they will wear when they leave their house. As our local government, you aren't called upon to do anything just to do something. You are called upon to do the right thing according to our Constitution, our Bill of Rights, and the oath that you took to uphold freedom and democracy even in crisis. Yet, we are here talking about this in ways that you can circumvent freedom and democracy and coerce businesses and people to set policies that discriminate. We live in Florida. Do we require sunscreen for anyone that steps outside or on the beach? Of course, we all know that skin cancer is very deadly. Are we prepared as county officials to bear the responsibility of health consequences of mask sickness for those that follow this resolution? Infections, accidents, workers' comp. The word resolution means verdict. Will this be the verdict of this commission? Will this be the legacy, mask wearing in Walton County? Then why would you inflict a resolution on 99% of a healthy population that has greater statistical evidence to sicken them? If you can't prove the effectiveness of masks and you personally don't support a mandate, then why would we pass a resolution that reads as a mandate? The ones pushing you to do this demand you to virtue signal for reasons that bear no statistical evidence that masks actually work. Are we satisfied to embolden demands from a small faction who will call for mandates or closures next because we walked up to the line, but we didn't cross it? Are we okay with demanding you to break your oath and to overstep boundaries into the personal lives of your constituents? Do you not see that by granting credence to them, by any such resolution, you continue to invite this back into your sessions and into your county? You cannot stand for everything or you stand for nothing. Sometimes the best resolution is to not render one. Coronavirus will die off, but so could individual freedom and civil liberty if we don't protect it. Once we use the government to infringe on the liberty of people, people suffer. I wish you the courage to stand strong for democracy and freedom in the face of passing storm. Request motion to table.
Thank you. All right, we'll start over here with the lady in the black with the white polka dots. You want to speak? And then we'll go up that row and then back down over here. Go ahead.
Good afternoon, Commissioners. My name is Tammy Molnar.
Hold the mic down. There you go.
Okay, thank you. Okay. Good afternoon. My name is Tammy Molnar, Molnar. The mask resolution actually hugs the line of control instead of giving people the freedom of choice over their own health. Jim Mahane, an MD and medical surgeon, has a great statement about masks. He says, quote, "I'm a surgeon that has performed over 10,000 surgical procedures wearing a surgical mask. I believe that fact alone more than qualifies me as an expert on the matter. Additionally, I am a former editor of a medical journal that knows how to distinguish good science from bad and fact from fiction. Since the beginning of the pandemic, I've read hundreds of studies on the science of medical masks. Based on extensive review and analysis, there is no question in my mind that healthy people should not be wearing surgical or cloth masks, nor should we be recommending universal masking of all members of the population. That recommendation is not supported by the highest level of scientific evidence. Let's be clear. The premise that surgeons wearing masks serves as evidence that masks must work to prevent viral transmission is a logical fallacy that I would classify as an argument of false equivalence or comparing apples to oranges. Although surgeons do wear masks to prevent their respiratory droplets from contaminating the surgical field and the exposed internal tissues of our surgical patients, that is about as far as the analogy extends. The COVID-19 pandemic is about viral transmission. Surgical and cloth masks do nothing to prevent viral transmission. We should all realize by now that face masks have never been shown to prevent or protect against viral transmission, which is exactly why they have never been recommended for use during the seasonal flu outbreak. The failure of the scientific literature to support medical masks for influenza and other viruses is also why Fauci, the U.S. Surgeon General, the CDC, the WHO, and pretty much every infectious disease expert on the planet recommended against surgical mask wearing early in the pandemic. Although public health authorities like Fauci flip-flopped and changed their recommendations, the science did not change. If a surgeon were sick, especially with a viral infection, they would not perform surgery as they know the virus would not be stopped by their surgical mask. Unlike the public wearing masks in the community, surgeons work in sterile surgical suites equipped with heavy-duty air exchange systems that maintain positive pressures, exchange and filter the room air at a very high level, and increase the oxygen content of the room air. Surgeons and operating room personnel are well-trained, experienced, and meticulous about maintaining sterility. We only wear fresh, sterile masks. We wear the mask for short periods of time and change it out at the first signs of the excessive moisture build that degrades their effectiveness and increases their negative effects. Surgeons never reuse surgical masks, nor do we ever wear cloth masks. The public is being told to wear masks for which they have not been trained in the proper techniques. As a result, they are mishandling, frequently touching, and constantly reusing masks in a way that increase contamination and are more likely than not to increase transmission of the disease. I personally have talked with those waiting tables and in the service industry that are forced to wear masks all day in order to get their paycheck. They are saying they can't breathe well with them on, their masks are drenched with sweat, their customers can't understand them, and they are experiencing scratchy throats at the end of the day. There's a much bigger picture here as it relates to freedom. Ben Franklin wrote, "Any society that will give up a little liberty to gain a little security will deserve neither and lose both." I ask that you motion to table the resolution.
Thank you. Sir, you're next.
Matt Christopher, CHRISTOPHER. I probably won't take the whole 3 minutes. They're all saying everything that needs to be said. I think Mr. Anderson asked, are these things harmful when we wear them? I think we've shown you get higher CO2. There are people passing out from them. You get pleurisy, lung infections, bad problems from wearing these. I'm really confused as to why this body would want to recommend that all businesses say, wear something that can be harmful to you. That's our recommendation. You should wear something that can be harmful to you. That doesn't make a lot of sense to me. And we've also seen that they probably aren't very effective at stopping the transmission of you getting COVID-19. So why are we recommending that you wear something that's probably not going to stop you from getting it in the first place? That just doesn't add up to me. I don't know why we're making this resolution. Really, it comes down to, you guys had also been talking about numbers back and forth. Got, what, 70,000 people in Walton County?
Give or take.
How many people are sick with it? 12. Well, 12 are in the hospital right now. Of 1,400 tests that are positive, you have 12 people that are sick. Do you know what the percentage is of that? 0.001% of your population is affected by COVID right now. 0.001% of this entire population of the people that you serve are affected with this disease right now. What are we doing? Are there not better things that we can be talking about than COVID right now? Why are we having this? And until we just table this and just say this body is not discussing masks anymore, we are not even going to bring it up, we don't recommend it, we don't, make your own choice. That's what we say, and we're going to get back to doing what Walton County needs to get done. We've got so many other things, 5th fastest growing county in the nation, and we are spending week after week after week discussing this for hours. I'm sure you guys have much bigger things that you would like to deal with. I'm confident that that is true. So I just don't see where the emergency is. I think all of us agree where's the emergency? We're putting people at risk. We're going to have this body recommend, that's our recommendation, is that all businesses recommend people wear a mask that could be harmful to them. We should be doing the exact opposite, honestly. We should be saying, we ain't doing nothing. We are done with this. We are not talking about it anymore. We're taking a stand as a body, and we're going to take a stand and be done. We're just done. And we're going to move on, and we're going to do the right thing for this county. Because 0.001%, that's it, 12 people. You can say we got 1,400 positives. You got 12 people that are affected by it right now. And that number really hasn't changed. If you look at all the weeks back, that number has not changed. So make a motion to table it, be done with it. That's what I recommend.
All right, thank you. Gentleman is looking, I don't know if he wants to speak or not, in the light shirt. Do you want to speak? The lady in the back? Oh. I don't know what she said. All right, we're going to start. No, I'm going over here. Go ahead.
Good afternoon. My name is Wendy Adams. I want to thank you for hearing our public comments on mandatory masking 2 weeks ago and choosing not to enact such a measure. For good reason, there's no scientific studies that prove masking in public slows the spread of coronavirus. What's more, masks are dangerous for our health. They're unsanitary, they restrict oxygen, and force the inhalation of excess carbon dioxide. Additionally, such a mandate, even if they worked, and they don't, even if they were safe, and they are not, would be a violation of our civil liberties. It is for these same reasons that I should expect that you would not choose to recommend such masks for public use. It seems such a resolution is a gesture to appease a very local minority in the community that are irrational, panicked, and fearful, who would have you shut down the beaches and ban the tourists if they had their way. If, in the interest of public health, shouldn't you take the trouble to recommend a healthy diet for building a stronger immune system to fight the COVID virus? Why not recommend eating fruits and vegetables, supplements, sunshine, vitamin C, fresh air, and exercise? If in the interest of public health, these are the things that are proven to make us healthier. And I must point out that there is nothing in this resolution recommending that everyone wash their hands, which is the most basic and proven of the CDC guidelines. Is this resolution actually recommending that people wear masks outside on the public beaches, outside in 90-degree heat? Why would the committee pass such a resolution that no one will adhere to? This gesture appears to be at best disingenuous and at worst potentially dangerous. And finally, please clarify how this resolution applies to children. Have you considered that if a masked child is kidnapped by masked kidnappers, how will witnesses identify the child for the Amber Alert? How will the muffled screams be heard? How would the kidnapper be identified? As a former probation and parole officer who has supervised convicted sex offenders, this is something that you must concern yourselves with. Masking makes abductions all too easy for the predators and much too difficult for law enforcement. In fact, wearing a mask or hood or device whereby any portion of the face is so hidden, concealed, or covered as to conceal the identity of the wearer in public has already been prohibited by Florida state law since 1951. According to Florida Department of Law Enforcement, there are 166 registered sex offenders in Walton County. I ask that you table this resolution.
Okay, thank you. Yes, sir.
Lee Robertson, Robertson. I don't know how y'all can make a vote on this. You have no idea how many cases there are. Nobody knows. I've heard people say there's 10 times as many positive cases as anybody's even suggested. Like turning off the lights and having a moving target and shooting at it. Got no business doing this. I can't wear a mask. I go somewhere, I get looked at, dirty looks. I get told to get out of places. Not by the store, but by other people in the store. Y'all are gonna pass something that's gonna tell people to tell me what I can and can't do, where I can and can't go. This is wrong. You don't have any idea how many people have it. Half the damn county might have it. Like the fellow said, there's 12 people in the hospital. You're gonna start telling the whole county what's right and wrong with it? The CDC's changed their mind 8 times about what's right and what's wrong with it. Y'all gonna make decisions based on information that nobody knows is right or wrong. I would request that you would table this and make it go away. I don't need people jumping on me for going shopping. Thank you.
Thank you. All right, is anyone else in the room? I don't know if there's any in the hall. Have you spoke yet? All right, come on. All right, this will be the last one in this room, and then I got one to do on the Zoom. Go
Yes,
ahead.
sir. My name is Drew Robbins, Robbins. I normally spend my days working with people on their metabolic health. And I want to say we're your friends, those of us who are here to present our points of view. I feel like we have two different wills, one saying protect me, and one saying let me protect myself, with that rugged individualist that is the American ideal and our constitutionally guaranteed liberties. I understand your desire to straddle the divide. I wouldn't take your job for anything. And I say that very seriously. You guys have a rough job, not interested. Every day I produce a Walton County COVID-19 dashboard with a lot of analytics. I have to use about 12 different international, state, and national databases to do this. It takes a lot of time, but that's the only way to really get to the truth, to tell people what's going on. I study virology, immunology, cell biology issues associated with COVID, and I write extensively on these things. Let me just say this. There is no COVID emergency in Walton County, and I would challenge anybody to meet me anywhere and debate me on that issue and try to prove that there is. This is a practical COVID-free zone compared to any place else. Nice job. Nicely done for our police, for everybody involved in emergency management, so on and so forth. This is a great thing, and I'm very proud of that. But I think what we have to do is we have to realize that those who don't learn from history are bound to repeat it. Let's look at the history we have. Chautauqua, we've had 8 deaths, Chautauqua Nursing Home, okay? Before any of this got started, N95 masks for direct patient contact with gowns, gloves, and face shields for direct patient contact was implemented. Surgical masks for everyone else in the building. So, did that help? No. We had deaths starting in May that went through almost the end of July. 20.2 days is the average incubation start to stop period. So it's not as if everybody got it infected all at the same time. This has happened through time with masks. Now, I just did a comparative analysis between Holland and Finland, who have 80 to 90% non-mask compliance, and Italy and Spain have 80 to 90% mask compliance. Everywhere they go, they wear their masks. It made no difference. It made no difference. There's no difference in positives. There's no differences in deaths when you even, when you equalize for population difference. One final thing. Again, we're your friends, but I've watched a member of this commission play with the mask throughout this meeting, which effectively takes whatever's on that mask, puts it on the hand, so then whatever is touched after that is now contaminated. So we got to use these things correctly if you're even going to consider them.
Sir,
But
can
I ask
can
you
I ask
to-
you a question?
Yes, please.
What are your credentials?
My credential, I've worked for 6 years in metabolic health with 3 Pillar Health.
Okay.
Okay.
I mean, I wanted you to put that on the record
Okay.
and saying that. Thank you.
All right.
Could you see me after the meeting?
I certainly will, yeah.
Thank you.
All right, well, that's all of the comments from inside the room. I see one hand raised, Barbara Morano. Barbara, can you hear me?
Yes, sir.
All right, identify
wanna-
yourself and spell your last name for the clerk.
I will. It's Morano.
Okay,
I
go
want
ahead.
to thank the commissioners for agreeing to place the resolution on this agenda. This resolution, as Commissioner Glidewell said, is not a mandate. It's to encourage. It doesn't, and I'm saying this, not Commissioner Glidewell, but it's to encourage, and it does not infringe on freedom, and it's not political. The state Surgeon General and Holly Holt even mentioned that we should social distance. If we can't, then a face covering is encouraged. Let me go on a little. I'd like to mention a population that's gone unmentioned during this whole discussion and during the last BCC meeting, and they are the children of Walton County. The children. Teachers and administrators have gone back to work this week. Commissioner Nick, I'm sure you know the concerns of teachers and parents. Children, you have a wife who's an administrator. I call the office of the superintendent of Walton County Schools. We have 71% of the students returning to 100% next semester. But we must act now. Our guests, tourists, come here from various hotspots around the country. Some, not all, think Walton County is party city. They come for a week and they go. They're tested in another state, they're tested in another county, they're tested in another place. We all want our beaches to remain open. We can agree on that. We want short-term rentals to continue. We all agree on that. And we want all our businesses to thrive. We all agree on that. The 14 and 28 all right, we talk about that. Holly Holt talks about the death rate, the amount of ICU beds. Have a statistic on recovery of those who test positive. Commissioner Anderson, you were very passionate about that. All good information, but this virus is devious, deceptive, and debilitating. Long-term symptoms remain unknown for those who test positive, sometimes for those who test negative, for those who are asymptomatic. We honestly do not know. There is nobody in that audience that can say that there will never be long-term symptoms. We don't know. Passing this resolution sends a powerful, positive message that's flown from that emergency order that the county enacted. It basically says we care. If a business requests that you wear a mask, you're backing that business up. You're encouraging that business to make that statement. And for those in the audience who choose not to wear a mask when you go into public,
Barbara,
sorry, but-
your time's up. Thank you.
all right, I want unanimously supported. Thank you.
Thank you. All right, that's, well, there's one name popped up, Christopher Gossett. Christopher Gossett, are you there?
Hear me? Hello.
Okay, I hear you now. If you will, identify yourself, spell your last name for the clerk.
Hi, name's actually Derek Gossett, Gossett. I also wanted to push for the table motion in regards to the last caller. She said it herself. There are too many unknowns as far as long-term symptoms and what's going to happen to those that are asymptomatic. So she's giving you an opinion, an unknown, and an emotional response. All of the individuals that I call friends in that audience have given you facts backed by peer studies, peer reviews, and scientific data. So I would like to, let the last word speak loudest in saying, don't vote on this politically, go based on what they've presented to you with the facts. Thank you, and sorry I couldn't be there.
All right, thank you. All right, I'll close the public comments section. If I ain't mistaken, there's a motion on the floor along with some modifications to the actual verbiage that's listed in there. I'm gonna reserve my comments to the last, and so indulge me for a few minutes. Since this thing started back in February, March, I haven't wore a mask. I felt it was my decision as an individual whether I wore it or not. Now, I do respect in certain locations, like maybe a hospital. My dad's 96. He's not in the best health, and I have not gone to see him. And I just don't want him to possibly catch us. I've tested negative. I've had and talked with people that I have concerns that the information that we receive is contradictory at times, it's inconclusive at times, it's not exactly the same message every time. And we are like the CDC. They've changed, like the gentleman said, they've changed multiple times over the last several months. And I know this thing supposedly is fluid. It moves around, things change and what have you. But I've always felt if you wonder where, that's your business. I do not think government is in the position to mandate everything and protect everything that may happen out here in the world. And for that reason, I can't support the resolution. I would prefer this thing, we've kicked on it for over a month. That horse is dead. They need to move on. We got more important things, in my opinion, that we need to be addressing. So I just put it out there right now in front of God and everybody. I'm not in support of it. Please,
Mr. Chairman,
go ahead.
I battled back and forth on the mask, and, I have worried about, and I would ask Mr. Fields to see me after the meeting with his machine. I too have trouble with government, but just for you people out there that are asking to table this motion is not what you want, because that means we're gonna bring it up at a later date. So.
Well, that's true. If it's tabled, it can be brought up at a future date.
But Mr. Chairman, I have, there's so much back and forth on this mask thing, on this disease itself. Other than the carbon dioxide, which I've struggled with, understanding why it's not affecting me, but I have trouble making people. But I know this is just a recommendation. And my recommendation, if you want to wear a mask, wear a mask.
Do we need to put it in a formal resolution?
No, I don't think personally we do. I think it's everybody's individual decision, but I also think it's a business's decision if they require a mask. And, you know, I'm a pretty old guy, and there's gonna come a time, probably in the near future, where I have some of the problems that some of you in the audience have. And, I can tell you, if there's anything, even a chance that I'm breathing carbon dioxide, then I'm gonna have a hard time wearing a mask. And, Mr. Fields, that's why I'd like to see you in your machine when we take a break. But I, you know, if, I'm not saying that masks work, and a couple of you said something about wearing masks is not gonna protect you. I don't think anybody said it's gonna protect you. The thought process of that is that it's going to protect others. And I'm not sure if that's true or not. Like I said, and Holly might can tell me if there's any science on it, because I've seen it bounce all over the place. I don't think we should tell a business what they can and can't do. Now, do I think they have that right? I do. If they can say you gotta have a shirt and shoes on to come in their business, then they can certainly say you have to have a mask. And for all of you that get upset about that, you don't have to go in there. You can go somewhere else to shop. You know, you might have a little bit of a hard time finding a grocery store that doesn't want it, but heck, you can shop online. They'll deliver your groceries from Publix for a minimal fee. But I just don't know that we need to order businesses or even recommend businesses
Okay.
keep people out.
Mr. Chairman, briefly.
Briefly, please.
Was that shot at me?
After both of you, go ahead.
I'm always brief. I made the motion so that we could take the language out that was, I thought, leaned towards a mandate. I intend to vote against my motion, which sounds crazy, but bear with me. If we table the motion, it can be, as the chairman said, it can be, or as Commissioner Anderson said, it can be brought back. Under our rules, reconsideration, once an action is taken on a proposed ordinance, resolution, or motion, neither ordinance, resolution, or motion, nor its repeal or rescission may be brought back before the commission during the 6-month period following. So, in other words, if we vote on it and vote against it, we kill it for 6 months. So, I made the motion, but I intend to vote against my motion for those reasons. It's a parliamentary issue.
Commissioner Everett,
I spoke with Drew, and I told him, I said, I feel like this is benign. Those are the exact words I used on the phone with you. After hearing you, I don't think it's benign. I think it's exactly what Mr. LaSalle and other people are saying. It's stepping on our infringements, and it's more and more. And what bothers me is I can't stand wearing that mask, but I have to go to Publix. I've got to go to Walmart. I'll wear it because those are my grocery stores, but I don't have to go there. I can shop online. I can do other things. So I'm in concert with Commissioner Gladwell.
All right, Commissioner Nick, you got any comments?
Make it short.
Yeah, well, I tell you, you know, I don't require it in my business. You know, that's right. And I tell you, I'm not gonna sit here and tell you as a government official that you need to do this. If I want to smoke my Marlboro Reds, I'm gonna smoke my Marlboro Reds, and I don't want you telling the government telling me I can't do that. So,
You don't even smoke.
I started today. So, but, I think you know where I stand on it.
All right. All right.
So now it's, yep.
Call the question. All right. All in favor, say aye on the question. We have to take a
aye.
vote on the call of the question.
Aye.
Oh, aye.
Yeah.
Aye.
Don't confuse
Okay.
That's
You
okay.
ayed? Okay. All right. Well, you know what the motion is? It's on the floor, and there is a second. All in favor, say aye. Opposed, say nay.
Nay.
Hey.
Nay. It's dead. We're going to take a 10-minute recess. We're in recess.